For me, exercise means when you finish exercise, you feel, you sweat and you feel very fresh, but your body shouldn't really get tormented by the exercise. That is not going to help anybody. And there is no proof to show that people who do this extreme exercise, they live longer or they have a better quality of life. Certainly not. We have seen all these people who are practicing heavy weight lifting, and when they grow older, they have their own problems with all this wear and tear. Gyms are there, they have to exercise for, the place for people to exercise for half an hour, 1 hour. You sweat, you feel very good. That's the best thing what can happen, but not to get into this kind of a very irregular exercise habits, doing too much of exercise in a short period of time. Yeah, which may not be very good for the human body. Anyone who gets into this extreme sports, even they are 25-year-old, they have to go for the preventive checkup. Say there, say the armed forces in US, they had quite a few casualties, young people dying suddenly during in a very extreme exercise. And they introduced this concept of screening everyone for all these major problems. So essentially, it is very important that even young people, because in India especially, we have a very high incidence of, much higher incidence than other countries of anomalous coronary arteries. Coronary arteries come from the, this is the main coronary artery called left anterior descending artery. It comes in this position. In some patients, it comes between the main artery here. And the main artery can squeeze it at the extreme exercise, and they can suddenly drop down dead. It's called anomalous coronary arteries. Nearly 1.5% of Indians suffer from anomalous coronary artery. We have studied more than 30,000 CT angio, which we have published. In India, the incidence is much more than in the Caucasian population. And also, we are very likely to develop coronary artery disease. That's a blockage in the coronary arteries. People who want to jump up and down on the treadmill and do all kinds of extreme sports, they should be, I'm not sure whether gyms have a policy that, if they're on any cardiac drugs, that is the only question you have to ask. Are you on any cardiac drugs? If they are on cardiac drugs, then definitely they need to be certified by a doctor for the cardiac fitness.